Exploring and optimizing your brain's connectivity with your body, this is Brain Training. Welcome, everyone. I'm Dave Williams and joined by our guide on all things brain-related, Bob Gold. Brain Training, Bob, is an entire series that's dedicated to maximizing the brain-to-body connectivity. Bob, you've spent 20 plus years of applied research and development experience in the areas of the behavioral and cognitive science of human motivation, activation, and resiliency. You founded Gomo Health and you serve as their chief technologist. Your passion, your focus for you, Bob, it feels like it all starts with the brain. Why?
Why? Your brain not only detects reality, but creates reality. It controls the movements in your body. It determines your fears, anxieties, your emotions, and it has a tremendous effect on you, your family, your work life. So it's really the center of your life.
So in this series, Bob, we're going to dive into all things brain and getting the most out of the brain, optimizing the brain and body connectivity for desired results. Some shows will focus on broad topics like our recent Peak Performance in Sports program with Donna Deverona. That was fun, man.
Yeah, what great stories. Olympic medalist, and her story about Mark Spitz was fascinating.
It's really cool, and I'm looking forward to today's program as well because it is like some of the other programs where we're going to be focusing on a specific vertical, a health challenge like substance abuse, or like today, we're focusing the entire program on the cancer journey, dealing with the fear, dealing with the uncertainty. Bob, this is an important topic.
Absolutely. About a third of Americans will develop cancer in their lifetime, and 40% of those will go through their entire life savings in the first 2 years of treatment. So how people get through this, how they deal with it, is extremely important. There's exciting developments from physicians like Hamza and Chevon that are happening that people need to know about that we'll be talking about today.
As Bob just teased, in each episode of Brain Training, he's going to share perspective and insights with distinguished guests at the highest levels in their respective fields. Joining us today are two massively smart people who have dedicated their lives and every day to patients, family members, and of course, members of their healthcare teams to treat the whole person through their cancer journey. Dr. Chevon Rairy is Chief Health Officer of Oncology Care Partners, where she oversees innovative oncology delivery systems and is leading digital transformation, artificial intelligence, and emerging technology strategies. She has a medical degree from Harvard and is fellowship trained at Brigham and Women's Hospital and the University of Pittsburgh Medical Center. Welcome, Dr. Rairy.
Thank you. Thank you so much. Excited to be here and excited to have the conversation.
Also joining us is Dr. Hamza Habib. He joins us from the Rutgers Cancer Institute of New Jersey, where he serves as Director of Outpatient Palliative Medicine and Cancer Pain Service. He came to Rutgers from Columbia University after putting together its palliative care program. Dr. Hamza holds the rare trifecta. Get this, Bob. The rare trifecta of MD, JD, and MBA degrees.
Yeah, he makes me look slow. I never thought that could be, but he does.
Dr. Habib, welcome to Brain Training.
Thank you so much. It's a pleasure to be here. And Bob, thank you so much for having me. Look forward to an amazing conversation.
You got it. So, sort of as a warm-up, let me ask you first, Hamza. As a young physician, what is something you did or some practice you did that you realize now, after a lot of experience in dealing with patients and people, surprised you or you would do differently?
Bob, I mean, medicine is an amazing field. It gives you so many experiences and just, I mean, there's so many that I've had, but one of them really stands out to me, and that kind of talks to the humanistic aspect of medicine that we do, and it relates to one of my patients that I was taking care of when I was in New York City. This gentleman was 24-year-old, a law student. He was going into law school, and he wanted to take LSAT for his law school. And unfortunately, by the stroke of luck, he had Ewing sarcoma, which had metastasized to multiple parts of his body. When he came to us, he was already a stage 4 patient at that point. He was having a lot of pain-related issues at that point, along with anxiety, depression, and worries about illness and family and everything that comes with it. But at the same time, the courage of this man is that he was studying to take his LSATs. And he came to me and he said that, listen, doctor, I know I have advanced cancer. I have a lot of pain at this point, and you're giving me these pain medications for my cancer, which are very appropriate. But they're also making me very tired and sleepy. They are making me very sedated. And the way that this exam works, I cannot be tired. I need to be at my A game. And I was like, listen, I don't know what this exam is, but I want to look at it at least to kind of like see what it entails. And what that gentleman wanted was some extra time for his exam because he was on these medications that would make him slower in his response to certain very cognitively challenging questions on the LSAT exam for law school. So what he did is that he pulled out one of his books and he said, listen, doc, look at this. This is what I'm doing, and this is very challenging. And I looked at those questions, and yes, they were very challenging. They were very tough. They went into different aspects of your understanding, critical thinking, cognitive realization of different aspects of understanding. And as a young doctor at that point, Bob, I was like, oh, wow, this gentleman really needs to have a good quality of his pain management in addition to management of his other things so that he can perform at his best at this exam. So, I mean, we work on different things. We kind of work on multiple aspects of his symptoms at that point. And he enticed me to go into law school. I mean,
and maybe that's why you ended up going to law school. And it just it goes to show you that you took the time to help a person with his life, because if he's going to get through the cancer journey in a meaningful way, it's about his whole life. And Chevon, what about you? Like from when you first started to now, what are some of the lessons in dealing with people and the cancer journey that you discovered?
Absolutely. I would say I unfortunately, I don't think I have a very unique experience. Truly unfortunate. As you mentioned, Bob, 1 in 2 men in their lifetime in the United States will receive a cancer diagnosis, and 1 in 3 women will receive a cancer diagnosis in their lifetime. So it's fairly prevalent. As my husband would say, cancer is common. As a physician and as someone who was touched by cancer in my own personal life, I think my perspective has been fueled by the difficult journey that we experienced in navigating the current healthcare system within cancer care. So a few years ago, my family was impacted by cancer during the peak of COVID. So arguably one of the worst times in our lives during one of the worst pandemics we've ever seen. And for us, life changed in an instant. And I think the period, it evoked very complex emotions. And yet I was very cognizant, having obviously being a physician and having that background and insight and focusing on endocrine oncology and clinical practice, in the necessity to let that experience shape my perspective and have a transformative experience on my outlook. And so as we were navigating the healthcare system for cancer treatment, I experienced firsthand the frustration of such a fragmented system currently and the toll it could take, on one's path to recovery. We clearly this was a major setback for our family. We have 3 young children, and it sparked in myself the reality that life is quite short. It galvanized me, if you will, to really focus on what would be impactful and what would be meaningful, and fueled my decision in creating an experience, a patient experience that circumvented these challenges in the healthcare system, streamlined the patient experience, and that became my North Star. That became my focus.
Yeah, it's fascinating. You mentioned it changed your outlook and perspective and what's important. By the way, you have 3 adorable children, Chevon. And we're going to get into techniques around how to help train the brain on how to deal with that in a minute. So kind of to talk about that, just like what you went through, a lot of people are going through. So fear actually weakens the immune system, which is exactly what the doctors are trying to strengthen here. And so does a lot of the therapies in cancer. It also could cause tremendous amount of stress. And in Hamza world, in palliative care, stress increases muscle tension and pain. High blood pressure leads to depression, weight gain, sleep fatigue. And those are all things people need to stay in the game, to develop and foster resiliency. It's easy to give up. In fact, the two most common patient-reported outcomes when going through any complex condition, but certainly cancer, are 1, anxiety, and 2, fatigue. A lot of people just give up. So what's happening, though, is there's new patient-centered care models that are happening, and the use of digital health treatment protocols, like the ones I developed in Gomo Health, the ones that we're doing together with both Hamza and Chevon. So, Chevon, why don't you talk a little bit about tell us a little bit about Oncology Care Partners, and also how you're taking what's called in healthcare a value-based approach, and explain that to the audience. What does that even mean to them as a consumer around patient-centered care?
Absolutely. So at Oncology Care Partners, we are an innovative value-based oncology care company or a network of community-based physicians where we are leveraging technology to provide an integrated virtual and in-clinic experience for oncology patients. We're able to provide high-touch and high-tech resources to really improve the cancer journey for some of the most vulnerable patients in the U.S., so our Medicare Advantage patients, and all the while improving outcomes and lowering unnecessary spend. So to give more context, Bob, you mentioned value-based care. So what we are focused on at Oncology Care Partners is an alignment of incentives, if you will, across the board. So alignment of incentives between how we are reimbursed. We're reimbursed for quality and the experience of patients, as opposed to the behemoth of the current healthcare system is really reimbursed by, let's say, procedural-based or fee-for-service.
Yeah, I just want to say, and I think what that means to everyone listening, that's a really positive change. So it means that the providers are reimbursed based on the outcomes of the patient and the quality they provide, not just performing procedures and getting paid for those, right?
That's exactly it. And it allows us to invest in a proactive infrastructure to help patients at their most vulnerable time. And that's we know that the majority of patients spend time outside of the hospital. And so we're able to provide what we call wraparound services to extend the reach of not only in the outpatient facility or in the clinic with your physician, but extend the services beyond that. So we're creating multiple touch points where patients can be tracking their symptoms, they can monitor their adverse events, and be notified by our clinical care team in a proactive way to help decrease the emergency room visit that may be unnecessary, or decrease the chance of escalation to something that would require a hospitalization. And so it allows us to be more proactive in nature as opposed to reactive, where you're just paying for procedures.
Yeah, and you're right. People are 99% in their lived environment at home, work, and play, and their ability to mentally and physically be resilient is a factor of how they handle that. So we're going to get into, I'm going to talk about 7 brain-body techniques to help people with that in a second, but let me just ask Hamza, in your area in palliative care pain management, not only are you having all the stuff going through with cancer, you may have other comorbidities, and you're in a lot of pain. And so how do you handle those patient relationships, the family, and how are you using digital technologies like the one you're using from Gomo to help you?
Bob, great question. So, like you said, I mean, cancer is usually something that produces a conglomerate of symptoms. I mean, like you said, I mean, obviously there is pain, but there's anxiety, there is fear, there's worries, there's depression, there are financial issues, there are psychosocial issues. I mean, cancer is just one part of a patient's life, but everything else still moves on. So the concept that we work with in palliative care is the concept of total pain. The concept of total pain means that pain is just not physical. Pain has a psychosocial component. Pain has a spiritual component. Pain has an existential component. Pain has a personal kind of a component as well. So not only do we focus on just the physical aspect of pain, we look at all these aspects as well. So we provide support not just for the pain, we provide support for the mood-related issues, the kind of counseling that these patients need. And Bob, I mean, digital technologies have completely revolutionized how we manage some of these things. One of the most important things in any management of mood-related issues and all the fatigue and tiredness and concern about the illness or the concern from the treatment that comes in, I mean, we manage that with a big team of social workers and case managers. But the most important part here is that sometimes we are not able to get the data from the patient that they're worried. Sometimes it has to be scratched out. Sometimes it has to be something that is put forward to the patient that this is also something that we can do. And this is where things like the stress thermometers, this is where things like stress measurement tools are really important, and they're playing a huge role in kind of helping us get that data from the patient so that we can taper our treatments or provide certain treatments in certain ways that we cover all aspects of pain and everything that comes with it.
Yeah, and in fact, in both the program that Hamza does at Rutgers Cancer Institute in New Jersey and Chevon does at Oncology Care Partners, it has a concept of asking the patient on a frequent basis, how are you doing? It just says, how are you doing? And based on what they check, I'm having trouble sleeping, I'm in more pain, this or that, the content of the care plan, the clinical pathway changes immediately. So it reacts to the patient in real time based on their current need. And that's sort of how you get into value-based and patient-centered care. Now, to talk about some brain-body techniques, simple techniques that people could do in going through this, here are a few of them. One, breathing. Like, let's do it. Deep breath in through the nose, out through the mouth, typically 3 times. So breathing helps reset your body and mental functions. Music, listening to certain types of music, right, could help you because it occupies your brain, especially if you have headsets on like I have right now. Walking, nature. You know, we're all connected back to nature, water, fire, woods. So taking walks. Stretching is another good one. Affects your brain and body. And then even simple, give yourself a little hand massage in areas that may be uncomfortable for you to just take your mind and body off it. So those are some simple brain-body techniques that are deployed to do that could affect how you feel about yourself on a day-to-day basis. You know, one interesting thing I'd like to explore is what I call, with Chevon and Hamza, but what I call the patient and family's personal brand. You know, if you're a woman, for example, going through breast cancer, depending on the age of your children, I may not feel like I could take care of them. I may not feel I could work if I have to work. What's my risk factor now? Am I going to die? Right? So what am I willing to do and not do? You know? So who am I as a person? You know, it's fascinating. I think we go through that. So, Chevon, on your end, how do you effectively help people through that process, or how do you get at the your treatment protocols and the mind and those types of things? What are some of the services or ideas?
I think it's a very important point that you're bringing up, Bob, and Hamza mentioned this as well, where cancer is one component of, often one component of what a patient is experiencing. And it's important to recognize, one, what is important for the patient in this cancer journey, and two, how can the treatment regimen be constructed and the care and the support of the clinical team be tailored to the patient's particular interests. So as an example, you can have, we've seen certainly in clinical practice, very young patients with triple-negative breast cancer. I remember a patient that I was seeing in addition to our medical oncologist. And she had two young children that she was raising on her own. And she was interested in very aggressive treatment, whether that was clinical trials or other medication that may not have been proven as yet, in order to give her, to buy her time, essentially. And that was a true focus for her and was extremely important for her and her young children, as she developed a care plan, essentially, for her, for her and her children. She was stage 4 cancer. Versus we have another patient who might be in their 80s, have lived their life and is now experiencing, as an example, a form of leukemia. And instead of opting for more aggressive treatment, I recall a patient was really just interested in getting to a certain point where they can enjoy their grandchildren when they came to the home. So as an example, pain medication was important, but not a significant amount of pain medication such that they wouldn't even remember that they were there, or was too sedative. So shying away from aggressive treatment in that case was what was necessary. Getting early palliative care involved or early supportive care involved was important. And all the while creating an experience where patients had access, if you will, to our services 24/7, 7 days a week, for symptom management, for navigation and coordination, for other issues that they might experience, like nutrition or mental health, or social work or rehab. All of those are an important component of the care plan as well. So really understanding the goals of the patient sets one up for success in how they experience their cancer journey.
Yeah, I think that's brilliant. And in my area of science on human motivation, activation, resiliency, Chevon, I think what you did is, the voice of the patient mattered in their care plan. So, one, if a patient or family believes their voice matters, they're more likely to follow a care plan. It's sort of like work. If your boss tells you everything to do versus allows you to come up with things, you're more likely to do them if you have more influence. The second thing is that it considers their lifestyle. It's personalized. So it sounds like that's the approach you did.
That's right.
And the third is they believe they could accomplish the tasks, right? Because if it's personalized, they don't think they can. And that's, I think, how both of you are using some of the digital health tools and some of your support team and the psychosocial support to get people on a day-to-day routine. So, Hamza, any examples of that, like that Chevon just went through from your perspective?
No, definitely. We get to see all these things every day. And Dr. Rairy put this very well. I mean, early palliative care integration has shown that there is not only increased quality of life perceived by the patients and the caregivers, but also there is longevity kind of a benefit that is achieved by doing oncological treatments with palliative care. And that was a study that was done and published in the New England Journal of Medicine in around 2011 by a group of clinicians, oncologists from Harvard. And we also have to see that early palliative care not only improves all those things from a patient aspect, but they also improve the perceived quality of care and the cost of care. That is a big issue in healthcare systems. So that is something really important. I'll give you an example, Bob. You asked for what I had. I had a patient with breast cancer recently. Again, same things. I mean, unfortunately, when this cancer usually strikes, people are in the prime of their life. This was a 45-year-old lady with 2 kids, a family, a very well-paying job, a supportive husband, a family, parents that she was taking care of. But once cancer struck, everything fell apart. All these things that she was taking care of, she could not. Actually, she became dependent on all the people that she was caring for. And it was a lot of psychosocial stress, and it was a lot of financial stress, worries about the illness, worries about the treatments, the side effects. So cancer impacted a lot of those things. And I mean, what we found is that obviously, I mean, we manage the pain and the symptoms, but focusing on the psychosocial aspects of things, finding support systems for not just her, but for her family, for her kids, for her parents, for her husband, to kind of deal with this illness as she went through the treatment. And palliative care was able to provide all that. Where the technology aspect of it came in was that we were not able to gather a lot of information. And I mean, she was enrolled in the GOMOS program for some of these symptoms, and we got an earlier analysis before she came to clinic of what she was feeling. She also got a way of getting all that data out to us, because we know that clinical appointments can at times be very stressful. People forget about things to discuss with their clinician. So she was able to get all that data to us prior to basically even meeting us, and that helped us prep our charts, prep ourselves for what we had to offer. So data and technology transfer in this process between us as clinicians and her as patients was super helpful and improved her quality of life. She's doing amazingly well. She's in remission right now, and we are glad that we had all these services through multiple kind of modalities to provide to her.
That's a great story, and very insightful to how you're using different techniques to handle that and getting data earlier. You know, early detection, early intervention tremendously helps with outcomes, reduces cost of care. So, you know, thank the both of you.
Yeah. Yeah, we have a lot to talk about, but if it's okay with you, doctors, we're going to just tap the brakes, a little pause here. I'm personally going to work on my breathing, and all the lessons that Dr. Gold just taught me.
And in fact, when we come back from break, I'm going to actually give you some steps to practice your breathing and other things right now and how to think about that.
Perfect.
So we're going to cover that.
We got that and more on brain training coming up right after this.